most famous physical therapist on the internet.
Hi, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
I'm sure you agree. But today we're going to talk about, is leg pain sciatica or femoral nerve pinch? You must see to assess and stop the pain. You must see this video, right?
Exactly, Bob. Right. These are actually can have similar symptoms and different treatment, but they kind of crisscross. And if you find out some simple things right off the bat, you can get to the problem.
Just the very location of it can help you give a pretty good clue.
Right. And we're going to cover all this over the next 10 minutes.
If you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. And by gosh, you're going to want to go to our website, bobandbrad.com, because we're giving away a huge thing. We're giving away a Sleepovation mattress. And 2 of their pillows.
Pillows.
So, yeah, they're very cool. Very good for pain relief.
Yep.
You can also find the contest at Bob and Brad on Facebook. It'll be pinned to the top of the page. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
There you go,
day.
Bob. All right.
Let's talk about the femoral nerve, huh, Brad?
So once again, the femoral nerve, you could think of it as the opposite of the sciatic nerve. They both come from the low back, the lumbar spine. The difference is the femoral nerve comes from higher levels.
Sure.
Okay, from
2 L1?
No, L2 to L4.
L2 to L4.
So we're talking in this level where the sciatic nerve comes from L4 to S3, so way down into the sacrum.
So it's higher up. It's higher up on the low back.
Now, here we have, this represents the femoral nerve. So I've got it coming from a higher level, and it goes in front of the pelvis into the hip flexors. In other words, the muscles that make your hip or your knee go up like this. Now, if that muscle group gets tight, it can actually pinch that nerve and give you symptoms in the leg. Also, you could have a disc up on that level causing the pain.
A disc bulge or a disc herniation.
Right. So you have to kind of determine which is which we're going to help you with. Now, if you go into the sciatic nerve, pop it off there. It comes off the lower level. It goes to the backside, and then you have the piriformis muscle being an issue.
Yeah, so in both cases, you could have a pinched nerve from the herniated disc or a bulging disc or a muscle.
Right.
Somewhere along the line, something's pinching on that nerve.
Exactly. So let's do the big picture thing first. Sam, you're going to have to leave.
All right.
Sorry, you did a nice job, but we don't want you anymore, and we don't want you to feel displaced or unwanted. Right. So the big picture is if symptoms, sciatica, typically numbness, tingling, burning, pain down the back and maybe the right or the lateral, the outside of the leg, and going down into the calf and into the foot. It may wrap around to the front depending on what level. And this is where it's not always clear cut.
Right.
But the femoral nerve will typically be in the front, into the thigh and into the shin.
Right.
Front and higher level because it's higher on the lumbar spine. So if the pain and the numbness and tingling is here, much better chance it's a femoral nerve versus back here.
Less frequent too.
Right.
I mean, I honestly can count on my one hand, like the number of patients I've had with a femoral nerve.
Right.
But it was very clear they had a femoral nerve problem when we saw them.
There you go. So one way you can actually, if you feel the symptoms in your thigh, you will want to find out the severity of it. And one simple way you can do it is just with a chair. This is a little too high for me. Let's say this is the side you're wondering about and your quads are tingling, numbness there. Go out like this with your good leg, okay? And see how easy that is to bring up versus the other leg. If this leg feels weaker, then if it clearly is weak, it's hard to get it up and that muscle is weak. And it's numbness and tingling, it's that level, it's a femoral nerve. But if it's that weak, or let's say I'm going to stand up. Oh, we were going to use that chair. It's best to use a chair with armrests, which now we have in our new facility here. It's a beautiful chair, too. Nice. Yep. So I'm going to get up with my good leg. If I can stand up like this, it's not too bad. Then I take the leg that you're concerned about, and it's like much more difficult. again, that side is weak. The quads are weak. I would
Numbness
recommend
and tingling,
right.
you know, and,
Yeah.
and you don't think you have a quad tear, you know.
Exactly.
Then you're starting to think, yeah, the nerve is so involved
Right.
that it's no longer able to innervate and
Right.
provide strength to the
It's
muscle.
weak, numbness, tingling.
Yeah.
You know, you may want to consider seeing a therapist or a doctor at that point, or you can continue to watch a video and see what other options you could try.
We never want to discourage you from seeing a doctor.
No.
I mean,
Right.
by all means, if you,
Right.
at that point, it probably is good to do. But we'll show you after you've seen the doctor what to try then.
Exactly. So at this point, what we want to do is determine if we can, is it the hip flexor or the femoral nerve from the hip flexor or from the
back
disc
itself.
right?
Yeah.
So what I'm going to do is let me get
You know
something.
one thing, Brad. I wonder if you don't try some extensions first, just to see if it gets better.
Some prone,
Yeah.
and isolate.
Right.
There you go. That's a good point. This is one of those things that we want to make it as easy as possible.
Yeah, we're trying to work through this even as we're discussing this. But do you think that maybe if they try that and it gets better, then why do they even need to do the rest of this stuff?
That's
right?
a good point, Bob.
So-
Let's keep it easy.
So some prone extensions?
Right, go ahead.
So what we're going to do is we're actually going to lay like this first. And you can even lay on your elbows a little bit.
Sure.
And you want to see, is your symptom down the front of the thigh feeling better? Or is this making it worse? And you could even try some micro press-ups like this.
Yep. Mini presses.
Yeah.
Press up. He's keeping his pelvis down tight.
Right. I'm
You
not
know,
lifting up like this.
So if this is making an improvement, there's a good chance it's in the disc, not in the hip flexor.
Right.
Although you are stretching the hip flexor a little bit with this.
I'm stretching the hip flexor, which would make you think it might make it a little bit worse, you know, if the hip flexor is tight.
Or it
you know,
might
initially.
loosen it when you come down.
Right.
So this
So-
is a good, I think you're right, Bob. This is a good way to start. Do some press ups and see how it responds.
Right. And if it starts to feel better, stick with that.
Right.
Well, I mean, that we're going to go purely by symptoms. What makes it better?
Exactly. Because
So-
that's how that should be
That's always
addressed.
safe.
Now,
So-
the other thing you can do, let's say that does not offer any relief.
Right.
Then we're going to do a little nerve flossing
Sure.
and go to that. And what we're going to do there is lay prone again, like Bob already was.
You want the strap, Brad?
Yes, I do.
I'll
Now,
give you the strap.
Bob's going to give me a strap. You don't need to have a strap for this.
Can I put it around your
Yeah.
foot?
You can use a belt or anything. All right. This is a little awkward until you get set up. So I'm going to be on my forearms here. Let me get that. And with flossing the nerve, what we want to do is bring the knee or bend the knee, bringing the foot up like this. And at the same time, watch my head goes down
Yep. It's important that you do both at the same time.
and up. So I'm visually thinking that my head, top of my head, like this is connected to my foot. So as I go down like that, it doesn't work out if I actually physically touch it, but how I coordinate the two. So when I flex my knee, it stretches that nerve, and that nerve is connected to my spine, which goes up into my head, of course.
So he's actually stretching it here, but he's relaxing it up here.
Right.
So at the same time, it's like you're flossing on the two ends of the nerve. And you want to be very careful with this because flossing can make things worse. If this starts making it worse, I want you to stop.
Right.
But if you can do it like 10 times the one day and afterwards it still feels fine, then you can continue this 10 times a day. But if it makes it worse, stop, try some of the other stuff, and then maybe try it the next day again. If it makes it worse again, you forget it.
Right.
It's just one of those things that can really help, but it can really hurt too if it's not appropriate or if you're not doing it right.
Right. And then we're going to go into one more option, Bob.
Sure.
Let's say you did the press ups. You weren't sure if you're having any progress or you weren't. And then you did the flossing. And the next
Sure.
day, it seems like nothing's happening while you're doing it. Or the next day, it's not improving. You can do a nice stretch on that hip flexor muscle to loosen it up. And actually,
Got a little bonus here.
a little bonus. They're saying you can actually, this also incorporates a little flossing. So it's two at once. Put your knee on a pillow. I'm going to go here. I'm going to keep straight, and I'm going to stretch that hip muscle.
Yeah, look how he's not bending forward. He's keeping in really good posture here. He's
Right.
standing up nice and straight.
I'm not doing this. Keeping up, flexing or extending the hip. Then you need to take the hand on the side of the hip that you're stretching, go up over your head like this, and go behind your head. And you can go pressure on, pressure off.
So he's stretching like this. I don't know if you can see that.
I'm gonna go like this.
Yeah,
so
there you go.
I'm here, and I'm going here. Whoop.
And again, it should not make your symptoms worse.
Right.
Correct, Brad?
We're just looking for a stretch sensation here. And, from what I've read, I can't say this 100%, but they're saying you get a little floss benefits from this as well, which I could understand. The big thing is, does it make it feel better? Does it feel good while you're doing it? And afterwards, if it does, you're going to continue to do this stretch on a regular basis, 3 to 5 times per day.
Now, you could do it to the other side just as a comparison, too, to feel,
Right.
get a sense of what it feels like.
Yeah.
So if Brad does it to the non-involved side, and that one feels really loose, no pain, no problems, and he does it to the involved side, and it feels really tight, really different, then, you might have a little bit of hip flexor issue.
So you're going to stretch the tight side.
Yeah. Either way, we don't want to do anything that makes your symptoms worse.
Right.
This is not a no pain, no gain. This is no pain, get rid of the pain.
Exactly. I have it improved. So very good. This is a rather
a difficult topic.
It is.
It's a difficult one, but if you have it, it's definitely treatable. You just got to do the right things.
Exactly. So. And the other good news is femoral nerve pain is not near as common as lower, which we have a whole, the sciatica problem, which we have a lot more videos
Check
on
those out
for your help.
Remember,
all right, Bob.
Brad and I can fix just about anything
except for
broken heart. But we're back and we're working on it. We're working on that femoral nerve pain, and we're working on a broken heart at the same time. We're working on a lot of things.
Yeah, but the distance, Bob, is a big difference, and I'm not going there. It's not going to work.
It's all the distance between the ears too. So thanks for watching.